Fourth, as we need to create capacity for H1N1 patients with comorbidities, we will be refining the treatment protocol for infected cases. Not all patients need to be hospitalized. If you look at the experiences in North America in particular, because they have longer history of dealing with these patients, the vast majority of the patients, in fact, are just sent home with antivirals, and only very few are hospitalized. Many will simply be put on antiviral treatment and be home quarantined and asked to monitor their condition. We will also review the use of Tamiflu for close contacts of confirmed cases. Fifth, we are gearing up our polyclinics and a few hundred GPs to treat suspect H1N1 cases. We call them PPC, Pandemic Preparedness Clinics. A bit of a mouthful. I would have preferred to call them just flu clinics. But they can be recognized by their decal with a tick mark and with a ready marks to show that they are ready to handle walk-in suspect flu cases. And they will only refer some categories of high-risk suspect patients to public hospitals. We will use the next few days to publicize to Singaporeans where are these PPCs and according to where you live, where you work, so that you know in case you develop some flu symptoms and you know where to seek advice. When the local biosurveillance data confirms significant community spread and we need to move from containment to full mitigation, we will signal to the public to use these PPCs instead of going to the hospitals if their flu conditions are mild. And this may happen over the next few days. Six, we will secure adequate supply of H1N1 vaccine for our people. Besides our existing supply contract with the vaccine manufacturer, we are also in active negotiation with other vaccine manufacturers. The objective is to diversify our supply of H1N1 vaccines because the vaccines produced by each one of them are not exactly identical. An important consideration will be which manufacturer can promise the best delivery timeline. But these are new vaccines, so they are still subject to clinical trials to ensure safety and effectiveness. So I think we should be realistic about the timeline for availability of a safe-to-use vaccine. Seventh, our scientific committee, which is chaired by DMS, is actively evaluating the characteristics and the genome of the virus. The good news is that the virus here remains identical with the virus in North America. You may remember there was an earlier press report about some Brazilian claim that the virus there has mutated and was no longer the same as the North American virus. But I think the report has since been found to be flawed. So the consensus view is that the virus remains moderate risk as described by WHO. Singaporeans therefore really do not need to panic over this development that there is now community spread in Singapore. Almost all infected cases will be able to recover fully. Tamiflu and Relenza remains effective against this disease. But I thought I should explain that moderate risk does not mean no death. Just like the seasonal flu, there will be some deaths. The data from North America suggested a case fatality of 0.37%. What this means is that out of 1,000 cases, one should expect a few deaths. And in North America, the number of deaths has already exceeded 100. And in Australia, they have already reported their first death. And that's why we need to target the high-risk patients, especially those with underlying medical conditions, and to render them the best chance of a full recovery. And that's why we need to allow our hospitals to be able to focus on the high-risk cases and not be distracted or overwhelmed by hundreds of mild cases. Overall, last week has been eventful in the development of the outbreak in Singapore. We expect this development We know that June will be challenging for us given the large number of return holiday travelers. But the 7-week head start has been extremely useful to allow us to gear up our system for community spread phase of the outbreak. Singaporeans should just carry on their lives normally, but do keep up a high standard of personal hygiene. WHO has a good acronym, WISE, W-I-S-E, WISE. W for wash your hands frequently, and that applies to everybody. Healthy or sick, wash your hands frequently. And remember the poster, the ugly poster with a lot of creatures on your hands, and those are maybe exaggerated, but not too far from exaggerations. And that's why it's so important to wash your hands. Apply to everybody. I is for me, is for us in government, is to keep the population fully informed, promptly informed, so that everybody knows the development of the outbreak. S and E refers to people who are sick. So S, please stay apart from others. Protect others. If you are sick, if you are unwell, the doctor has given you a sick leave, please don't go back to work, and please stay at home. And E, of course, is etiquette. Your sneeze and your cough. But for people in high-risk categories, and this will include pregnant mothers, people with asthma, people on kidney dialysis, people with immunosuppressant drugs, or on chemotherapy, and also other conditions, I think they will need to be extra careful. For example, they could wear a mask if they have to go out. Over the next few days, we will publicize our advice on what they should do, educate them on what they should do. We are considering sending them direct mailers so that these high-risk patients will be properly advised on what they can do to protect themselves. H1N1 is now globally pandemic, like other seasonal flu strains. Mankind has to learn to coexist with it, and that's why we are carrying on with our Asian Youth Games, and of course we'll carry on with school reopening and our National Day celebrations, and of course F1 as well. The reopening of schools will raise the risk of local transmission from infected students who have just recently traveled. And that's why it's important to get the recently returned students to stay at home for 1 week before they rejoin their classmates. Ministry of Education will provide more details soon. But overall, life must continue as normally as possible. We will still take some targeted control measures as and when an event occurs. For example, to close a school when a significant cluster is found so as to break the transmission, or to isolate a competing team from other athletes, as we did yesterday with the Filipino soccer players, and as we did this morning with the Hong Kong soccer players.